Today's headline is about rising concerns over South Africa's HIV statistics after reports of alleged foreign patient bans at some health facilities. The situation has created tension across communities and among health workers, leaving many questioning the reliability of the national HIV numbers. Before we go any further, make sure to watch till the end to see the sources and verify the news yourself, and don't forget to subscribe for more updates delivered straight from here in South Africa. Today's video and picture news covers the growing doubts over South Africa's HIV numbers following allegations that some health facilities have been banning foreign patients. Over the past few weeks, several reports have emerged suggesting that foreign nationals seeking treatment at public clinics and hospitals have faced obstacles, with some being turned away. This has raised alarm among health advocates, researchers, and the public. The big question is whether these alleged bans could affect the accuracy of national HIV statistics, which are vital for planning interventions, distributing medication, and ultimately saving lives. Health experts explain that South Africa's HIV numbers come from a mix of clinic reports, surveys, and population studies. Any disruption in patient access, especially if certain groups are excluded, could skew the data. If foreign patients are systematically left out of testing or treatment counts, the official HIV prevalence might appear lower than it really is. This could mislead government policy, funding allocation, and public understanding of the epidemic. Community leaders in affected areas have expressed concern, stating that healthcare should be available to everyone, regardless of nationality. They argue that HIV does not discriminate, and turning patients away not only puts individuals at risk but also endangers public health. These claims have sparked heated debates on social media, with some defending local healthcare priorities while others criticize the approach as discriminatory and counterproductive. Government officials have confirmed that balancing limited resources with providing care is challenging. South Africa faces enormous pressure on its public health system, which manages a high number of patients daily. However, health authorities insist that denying care is not official policy, and any such incidents are being investigated. Accurate HIV statistics are essential for the country's strategy to reduce new infections and provide life-saving antiretroviral therapy. This situation underscores a broader challenge in public health, making sure everyone, including migrants and foreign nationals, has access to treatment while keeping reliable national data. Health experts stress that transparency, clear communication, and ethical standards are key to maintaining public trust. Without these, misinformation spreads quickly, complicating an already delicate situation. Local NGOs and advocacy groups have stepped in to help, highlighting the importance of outreach programs targeting marginalized populations, including foreigners. Their work includes mobile testing units, community education campaigns, and partnerships with clinics to ensure no one is left behind. These initiatives show that healthcare access and accurate data collection are closely linked, and both are crucial for the country's response to HIV. Some analysts say this controversy may also reveal gaps in record-keeping and reporting in the public health system. By examining how patients are registered, treated, and counted, authorities may find weaknesses that can be fixed, leading to better data and more effective policies. This challenging moment could become an opportunity to strengthen the health system and improve outcomes for everyone. Meanwhile, ordinary South Africans continue to live with the realities of HIV. Many are frustrated by reports of alleged bans, worrying that some people may be prevented from getting treatment. Others are concerned about social stigma and discrimination from incomplete or inaccurate data. For these communities, accurate statistics are more than numbers, they are a matter of life and death. Health economists note that international funding for HIV programs often depends on credible national statistics. If the data is questioned due to access issues or discriminatory practices, it could affect future funding and support. This adds urgency for authorities to make sure all patients are counted and reporting is fair and transparent. Despite the serious nature of the issue, there are efforts to lighten the mood. Some clinics and NGOs have started community dialogues with local leaders, health workers, and patients. These events include quizzes and music sessions to make health education more engaging while addressing important topics. In summary, today's headline about alleged foreign patient bans raising doubts over South Africa's HIV statistics reflects both a public health challenge and a broader societal conversation about access, equity, and data integrity. Authorities, advocacy groups, and communities need to work together to make sure everyone receives care and the reported numbers reflect reality. Remember to check the sources we've used and subscribe for more locally grounded news delivered in a realistic voice. And just to finish on a light note, even when spreadsheets seem scary, a good laugh is still medicine, so if you know someone who thinks HIV data is boring, now is the time to share a joke with them. All images used are for illustration purposes only. News sources include News 24, Times Live, Health 24, and City Press.